with Department on Disability Services. As people may, I expect people are aware, we had our hearing yesterday, so we spent quite a bit of time talking yesterday. We'll see how many questions there are today. First, I will share our data. So people who have tested positive for COVID to date, 409, with 11 people thus far in February. By placement type, we have had 6 in host homes, 114 in intermediate care facilities, 1 in a mental health facility, 49 in their natural homes, 2 in nursing homes, 4 who are in out-of-state placement, 37 in residential habilitation placements, and 196 in supported living placements. So by placement type of our primary placement types, in intermediate care facilities, the COVID infection rate is at about 38%. And amongst those people, 17% have subsequently died. There have been 10.5% of those where that death has been confirmed as COVID related. In natural homes, the infection rate is still the lowest of any of our groups at 5.26%. And of those people, we've seen a 10% death rate amongst people who've contracted COVID. In residential habilitation, 33% have tested positive for COVID. 8% have subsequently died, but only 5.4% of those have been confirmed as COVID related. In supported living, 21% of people have tested positive, and 8% subsequently died, with 6.6% confirmed as COVID-related deaths. Overall, 17% of people supported by DDA have contracted COVID, and 11.5% of those people have died, but only 8.3% of that total have been confirmed as COVID. Thus far in February, as you can see, I'm hoping this is a trend. The numbers are down, and we have seen a reduction. So in ICFs, we had 3 infections in ICFs, 3 in ResHab, 4 in supported living, and 1 in a natural home. So of the people who have tested positive, who have required inpatient care, there's been 1 person in February of the 11 who've tested positive. Over time, there have been 140. As I said before, that was primarily in April. But so far in February, that number has looked much better. People with COVID-19 who have died, there have been a total of 47, including 1 person who did pass away this week. And that was presumed a COVID-related death. They were recently hospitalized for COVID. So that's the reason they are included as being presumed COVID. And we'll get that confirmation, of course, from OCME. But so to date, we have a total of 34 people who have been either confirmed or presumed as COVID-related deaths. There are 7 where it's been confirmed that, in fact, it was not COVID, and we're still awaiting the final determination on some. Amongst our provider staff, 641 provider staff have tested positive for COVID. 48 of those staff work for more than one provider, and sadly, 10 staff have died from COVID-19. And of the people hospitalized, there are currently 3 people who are still hospitalized. We did have, I'll preempt questions here perhaps. We had some very good news yesterday that DC will be moving to, what do they call it? I want to say phase. Yes, phase 1C on March 1st of vaccination distribution. And included in that is people with health conditions that place them at higher risk for serious outcomes from COVID. And in the presentation that the mayor provided yesterday, included in that list is people with intellectual and developmental disabilities. So we will be working, we've been working and will continue to be working with DC Health to coordinate to ensure that there is a path for all the folks who we support to be able to get a vaccination. Some of the people that we have, as people know, a large percentage of folks in ICFs and residential habilitation have already gotten their first vaccine, and they'll be getting their second next week at a very successful event with DC Health. We also do have a number of people who are over 65. So, they have been eligible and they've had the same challenges as everyone else with being able to register for and get in for the vaccine. And so, as we move forward, we, as I say, we will be working with DC Health. We've been in communication with them all along. So I don't know that there's any update today. But we will continue to work. And as we have updates about how we can coordinate that, we will provide those. And if there's anything else to add to that, Karen, please feel free.
Good afternoon, everybody. No, Director Reese, I think you covered it. Thank you.
So we had a number of questions at our hearing yesterday. I did my best to respond to them then. Could be that means we have very few questions today, but we are available. And please remember, as we always remind people, to scroll down to everyone if you are typing in a question in the chat, because otherwise we may not see your question. So there is a question, what percentage of people supported by DDA have received their first vaccination, and what percentage of staff have? So keeping in mind that the vast majority of people supported by DDA do not become eligible until March 1st, the percentage overall is not impressive. in terms of the people who are in intermediate care facility and residential habilitation, I believe the percentage was 85% of people in those placements were able to benefit from the first vaccine, and they will be getting the second next week. For staff, we are still collecting and compiling all of that information. And I will say that the percentages across agencies are very different. Some providers have been very successful. We've seen a couple where the early reports seem to be that 100% have already been vaccinated. And then we've seen some others with a very low percent. So my hope is that when we have our provider leadership meeting, we'll be able to talk together about that. And those that have been more successful can share how they were successful, what their strategies were, because they were different strategies, and that we can see that kind of success across all agencies. Can you review how PCR will be done in light of COVID? Should we anticipate having our reviews done on our typical schedule, or will the timing be adjusted? And Kirk is not here today. He could respond to that question. I don't know if Tasha or Diane are here and can respond, but PCR has been ongoing. I've been receiving those reports. PCR has been modified some so that it could be done. They resumed doing the provider certification reviews in, I think, July or August. So it has been ongoing for quite some time. There have been some modifications in how they do it to ensure that they're able to do it in a safe manner, but it has been ongoing, and I believe following the regular schedule. Do we anticipate DDA will arrange vaccine clinics, or will individual providers do that for those they support? As I say, we've been working with DC Health all along, and so we will continue to work with DC Health to see what kind of coordination there can be around those kinds of clinics for people. There are, once the guidance that I saw regarding the rollout on March 1st is that some people will be able to get it through their healthcare provider. And so the access to the vaccine, one of the most challenging things I think all along has been the amount of vaccine. So as the access to the vaccine opens up, there will also be more ways to get the vaccine. The benefit of the event that we had was that, to me, it felt like a controlled and well coordinated event where they were able to time well people's processing through the vaccine at the location. And so as I say, we will continue working with DC Health to plan for that. For DC Health, is there any updated DC Health guidance? It says, is DC Health mandating double masking?
Doris, this is Daryl Hawkins. I'm happy to address this question on double masking. I know there's been a lot in the news talking about the CDC update. And the headlines all say double masking. What I will mention is CDC's update did not talk about double masking. The point of it did, but in the context of really having a mask that fits properly, and that's really step one. So making sure the medical face mask that your healthcare personnel are using, like your DSPs, etc., fit well, meaning they mostly have nose wires. Using that medical face masks that have two ties that go around the head fit a little bit better than the ear loops for some people. So there's that. And then if they have a face mask that does not fit, like for example, it has gaps on the side for people who have maybe a smaller face, then There are other strategies that CDC has outlined to help the fit. One is CDC has a video and pictures on knotting it and tucking the sides to improve the side gap, and a couple of other options, including potentially using a cloth mask over a face mask, but that's really one of the many options. CDC, specifically says they do not recommend double masking two medical face masks on top of each other. So that still remains the case. And they also said that putting a medical face mask on top of a respirator is not going to improve the fit of the respirator, which is already designed to fit very securely on someone's face. So, to clarify, we get a lot of questions on this new update. That update is really about making sure your mask fits, and CDC providing some strategies that they found through research that could improve fit for some people. If you do employ any of those strategies for your staff, they should, just like any other PPE, need to be trained in that new strategy and how to do it well and safely so they don't contaminate themselves and etc. So thanks.
Of the 15% of the people in ICFs and residential habilitation who did not get vaccines in the first round, there's actually two questions that essentially ask the same thing. So, well, I'll go ahead and read the whole question. How many declined to get the vaccine because they didn't want to get it? And how many didn't get it because they weren't able to go to the event? For both groups, what efforts are being made to provide the first group with more information and to support the second group to get the vaccine? And the next question is very similar, so I'll read both and then answer the whole thing. What are the reasons behind the approximately 15% of people living in ICFs and ResHabs who have not been vaccinated? Is it because they've declined the offered vaccine or because they didn't access the clinic in January? So getting the specific data on each individual, we don't have aggregate data on all of the reasons, but we are collecting it. And it's an individual issue and it's being dealt with individually. So I'm not able right now to report out on, this percentage have declined so far, this percentage. So there were a variety of reasons that I can let you know that when I was reviewing some of the reports that we got, I was happy to see that one of the smaller numbers was people declining. There were issues related to people who had recently had COVID, who the healthcare provider recommended that they defer the vaccine, or people who were ill and were waiting until they were healthy, or people who had gotten other vaccines recently and they didn't want to get the two and it was recommended that they not get both at the same time. So yes, we are following up, and between service coordination and health and wellness, they'll be following up to track and then provide whatever kind of education people need in order to make their decision about getting the vaccination. Has anyone aware of mask management for profound ID not willing to keep on a mask so that they can attend health appointments? So the issue is, it seems to me, and please, maybe DC Health can respond, but a person who cannot remove a mask should not have a mask on. So I'm not sure what the strategy would be there other than to communicate with the healthcare provider about that limitation that the person has. And to determine, a safe way to facilitate them. And I want to emphasize here the importance of people staying in touch with their healthcare providers for any routine or chronic health conditions to make sure that people are following up with necessary healthcare and consulting with the healthcare provider about how that can occur. And maybe DC Health can speak some to, what kinds of things you can do if you are a person who can't wear a mask but has to get blood drawn or has to get healthcare in person.
Director Reese, what you mentioned is correct. So DC Health mask mandate says that individuals 2 and under and other individuals who are not able to remove the mask themselves without assistance should not wear a mask because that could be a safety issue. And if they do need to go to the medical appointment, I think along with what Director Reese said, communicating that with that provider and letting them understand the situation so that there's ways that they can then plan for that visit, that blood draw, or a necessary medical appointment. So.
So Tasha responded that she said PPR, but I think it's PCR. Reviews have resumed. They're in a modified virtual manner, but they should be on the regular schedule. Data collection method for staff vaccinations is convoluted, leaves a large area for overlap and error in the data. I think this needs to be looked at more closely. This is not the first time we've heard this, and I think it is being looked at more closely. We have gotten the reports from most providers, but we recognize in receiving those reports that they have required a lot of cleanup because of the kinds of things you're reporting, that the way that the data is collected, it requires a lot of then manual review in order to get a good assessment of the actual percentage, the real percentage of employees who have gotten tested. One of the issues for people who, are not providers providing us this data, we're not asking who got vaccinated. And so what we're trying to get is just the numbers of people and then, some understanding of where those folks work. And because there is overlap in terms of locations people work in, it's becoming challenging to make sure that we've got a complete and accurate report. I will say that the providers who have pointed out the challenges with it have been the providers where the vaccination to date has been the most complete. And so there we're recognizing what might need to be tweaked in that reporting to make sure that we get complete and accurate information. We're seeing some numbers come down in February. It would be very nice. What we want to be able to do is be able to track, as we're seeing infections as we move forward, what was the vaccination rate? What was the potential exposure for a person who, in their particular placement? And so that's the challenge of being able to do that also in a manner that, respects people's private health information. There's one person who has shared that in their experience for the past 7 months, they've been wearing 2 masks, a surgical mask and a cloth mask, and this has been very effective. I assume that means you've been healthy the whole time, and so I'm happy to hear that. But just as a reminder, there is, as Daryl said, good information on the CDC's website about effective use of masks and masking. And as a reminder, even as we move forward with vaccinations, they're an extra layer of protection. All other forms of protection, masking, safe distance, washing hands regularly, need to continue. Thank you. Carol says, seems like a good time to underscore how helpful these Friday calls have been and continue to be. Thanks and thank you. And I think something people raised was, an important question the council member had yesterday was, she had a question about our customer service line and that we don't get complaints about COVID-19 related complaints. And I said, well, I'm hopeful that we have a forum where all of those can get addressed. And so I do think that that as we move forward and as we look to actually moving beyond this, we talk about how we continue something like this, because I think it's been very helpful sharing of information. From my perspective, can I share highlights from yesterday's performance hearing? Yes. I think a lot of people came to speak about, to provide their perspective about the importance of expanding eligibility to ensure that people with developmental disabilities have access to the services they need in the same way that people who are currently supported by DDA who have intellectual disabilities get the supports that they need. That's sort of, as I think about yesterday's hearing, that's kind of top of mind from the whole day. Of course, we talked about COVID, but I think that some of the questions then were sort of the council member didn't have a lot of follow-up she may have otherwise had, because I think the mayor's press conference happened at the same time when she announced the definition of underlying health condition to include all people with intellectual and developmental disabilities. And I think that we should really recognize Karen, for one, who coordinates and makes sure that people with intellectual and developmental disabilities needs are being recognized in the vaccine rollout. And of course, all the leadership at DC Health that is, making sure that there's someone on that team who is focused on this issue. I'm trying to think of other, because it was it was our longest hearing since I've been here. But I will also say, it is and I said something yesterday to staff, it is the first time we had some RSA folks who had been helped successfully to obtain employment and move to independence come back and share their experience with the council, which was very helpful. It's nice to share all sides of how things are going, not just the frustrations. Of course, there are questions about and continue to be and will continue to be regarding the DSP wage issue. Across the country, the issue of the professionalization of direct support professionals is a significant issue that I think all states are grappling with and need to continue to grapple with. Housing came up. I think that the challenge is as you look at housing in the context of, the significant housing and homeless needs in the District of Columbia, the folks supported by DDA currently, I understand some of the challenge there because of the rents in the district. However, these are challenges that all district agencies are struggling with. And I think that what we have at DDS is pretty good. And so, when we look at the whole picture, it is overall an issue in the district expanding affordable housing. And, I think that as we move forward, maybe some discussions together about how we can even reimagine our services in terms of how people get housing and services and actually live independently, and live in supported employment that is their home as opposed to what feels like a provider's home. And, so I do think there are some, there's a lot to be done on that front. But that's true across the city. So first source is a huge problem for DD providers. We have workforce challenges of hiring people at $15 per hour as a whole. Finding DC residents is even more challenging. Is there consideration to partner with providers to address this issue with the city? I have not heard about the issues with First Source, and she asked me about it yesterday, and I haven't heard since. First Source is a requirement of a percentage of people that are hired being district residents. And what it means, though, is that the contractors with the district have to have a plan when they contract, and then they have to comply with that plan. And what occurred was, I don't know, not that long ago, a council member raised this question about how closely DOES was policing First Source. And so they started to do so more aggressively. And that is what made it more of a challenge, quite frankly. And Council Member Nadeau said that they will be addressing that more on the workforce committee. And so I would encourage people to raise those issues there. The technology first work group. So the technology issue came up, devices and proficiency. Is the technology first work group it says beginning to meet again, and I thought they'd been meeting throughout, but Crystal is here, and Donald, I don't know that he's a panelist, but Crystal could probably respond to that question.
Yes, the work group resumed meeting January 28th.
So can we hear more about DDS plans to track availability of devices and proficiency in their use? So we can provide an update on that. I can't answer that question right now. But those are important questions, I think, for the technology first work group to make recommendations about how we do those things. And then we can go from there. So actually, if Donald can be made a panelist, he may have more to share on these issues as well.
Oh, there we are. Good afternoon, everyone. Yes, in fact, the Technology First work group reconvened in January. And the core purpose of the work group really is, in addition to discovery and learning of emerging tech solutions, to also create strategies amongst stakeholders of implementation of the initiative. Of course, one of those strategies will be, how do we measure the current state of technology utilization, as well as how do we measure when we've made an impact in that transition to actualizing what a technology first system will be. So we're working closely with that, as well as some great other news to share. We will be rolling out a Tech First web series. One of the core components of the initiative is increasing awareness of what is actually out there. So we're hoping to do that through a Tech First web series where we'll be showcasing 2 to 3 emerging tech solutions, in addition to also sharing some best practices around remote supports, and also things such as just creating assistive technology goals, impactful goals. So there's a lot of things we're working on through the Tech First initiative, in addition to rolling out a shift curriculum. Shift curriculum is looking into accreditation for our provider organizations to become a Tech First accredited provider, really giving them the fundamental skills for implementation and planning around tech for the people they support. And I'm sorry, Grace, if I was going so fast. I've gotten so used to doing this in my sleep. Streamlined process, yes. To date, we have 3 providers who are approved to provide assistive technology services. One of the goals is to actually work with those assistive technology providers. So we have a standardized way of how we assess people and how we match them to tech solutions. Of course, always based on keeping in mind it being a first and foremost person-centered approach to that, looking at that person's unique strengths, preferences, limitations to match them with that tech. That is something else we're working on to standardize. At the time when we have a draft of what that tool will be that the AT providers will use, we will work with them to field test it first and foremost before the ink dries on anything and see if this is an effective tool.
You can take the next one too, Donald.
Yeah, so how to use it.
Donald?
Yeah.
Hey, Donald,
Yes.
not everyone on the call has access to the text, so it's always helpful to read the question first.
My apologies. I'm not as seasoned as you. Question is DDA monitoring regarding whether people have technology and know how to use it? We are starting to make an effort to communicate with providers about who and what locations actually have, for example, internet and technology. To the latter part, I really would like to shift the focus to building partnership throughout the district. So, for example, we have our AT Center and also our Accessibility Center. I met with the Advisory Council yesterday to discuss as partners, how can we bring some type of resource to the people we support that teaches them the basics of how to use technology. As you know, DDS has a lot of work to do as far as making sure our system makes accessing or acquisition of technology more of a streamlined process. However, the basic skill sets for people to even use those devices is probably a primary need. So really looking at what can we offer in partnership to our community for people to learn the basics about tech. Being that the environment we're in now with trying to social distance, what does that look like in this setting? Do we explore something virtual in addition to exploring something virtual where there can be some kind of virtual hand-over-hand guidance and instruction? Just some of the things we're trying to creatively think of out of the box to support that. This is an EVV question. How will providers with technology concerns be addressed with teaching the DSP regarding the SAM data? I would advise, being that DHCF is the lead agency for the EVV project, that you outline or send what are some of the challenges or technology concerns to evvinfo@dc.gov. So that can be identified as a team effort between DHCF and DDS. to move forward with potential solutions. I'm not quite sure if you're talking about right now the EVV system for direct support professionals. It can either be used via an app on a cell phone or through landline. I don't know if your question is directed to the usage of app or cell phones, or is there another high level issue with signals or things of that nature? So it's best if you really send that to EVV info so we can review that as a team and make sure that's addressed on the next agenda at the monthly stakeholder meeting. Is there any update, possible update on telehealth pilot? You're welcome. Director Reese, do you want to share any?
I don't think there's an update at this point in time, is there?
No, not to date. We're still in the process of waiting approval for any pilot.
We're exploring options for how that could work. Is there an update on the day provider meeting? I'm looking for Tasha to send her that question.
Can you hear me?
Yep.
Wonderful. Good afternoon, everybody. This is Tasha. We raised that as part of our quality managers meeting, and so the planning has begun, but I don't have a date certain yet, but we're discussing getting it back on the calendar. I do believe that one of the recommendations, though, is that the next provider leadership that we carve out some time for day issues. And I will say I thought that was a good idea because I know one of the challenges is that right now, in order for people to go back to the day programs or have day activities through day providers, it's going to take a team discussion, which of course includes the residential provider. So it might very well be that we have the conversation during the provider leadership and while we have everybody together. So that is also one of the possibilities that's on the table. So look for that potentially as part of the next provider leadership.
That sounds like a really good idea because right now I don't think you can think about them in silos like that. So it seems we have no additional questions at this time. Usually once I make that statement, we get a couple. And so we'll keep this up for a couple more minutes. And then I hope everyone has a nice weekend. Stay warm and safe. And we will be talking next week. But for now, I'll ask that we not close this out until 12:53 to give people a couple minutes if there are questions. And have a great weekend, folks. Okay, thanks. We'll talk next week.